Dana Rockey, and I've been a dentist for 34 years. About a year ago, I opened a brand new practice in Newport Beach, and there we practice what we call wellness-based dentistry. And even though I've been doing dentistry for 34 years, I'm very excited about our new emphasis of what I call oral systemic dentistry or total health dentistry, where we not only look at a patient's oral cavity, but really what's going on in the rest of their body and how each the body affects the mouth and the oral cavity and affects the body. So we are really excited about treating patients as a whole, and we, after all, are in what I call healthcare. And sad to say that many in dentistry today believe that dentistry is procedure-driven. Well, I still believe that dentistry is patient-driven, and in that regard, we do wellness-based dentistry where we take a look at the patient as a whole, and I'm really proud of that.
Hello, I'm Dr. Bill Sears. I'm a pediatrician of 50 years, father of 8, and I practice with my 2 sons, Dr. Jim and Dr. Bob, in Dana Point, California. And Dana and I have a lot in common in the way we practice medicine. I practice medicine, as he says, personalized medicine, the whole body. So it's not only the skills, what you do, we also prescribe the pills, but that's a model that often doctors forget. It's not only, doctor, what can I take? It's, doctor, what can I do? And that's really what we want to share with you today.
This all started for me, this concept of oral systemic, about 4 or 5 years ago when I joined an organization called American Association for Oral and Systemic Health. And that's where it's an organization of physicians and dentists and chiropractors and nurses and wellness professionals all working together. So when you mention that cardiac and periodontal connection there, we've actually been talking about that in our dental community since 1999. And physicians, I must say, have been a little late to the party being able to quite get the connection. But it is true that oral bacteria migrate from the oral cavity into the bloodstream, and of course the number one area that you sort of don't want that to go would be the heart and the cardiovascular vessels. So we've been talking about that for some time, and I'm glad that physicians like yourself and more are coming on board and realizing there is a connection that we can, as a team, work to solve.
Yes, and in fact, we physicians are starting to use dental terms like microbiome and biofilm. Biofilm is a wonderful word that I learned from you, actually. And as I understand, biofilm is all of our cavities are lined with a protective paint, I call it, called biofilm, I think, in dental jargon. And the better your bacteria are in that biofilm, the good bugs crowd out the bad bugs. So you have a healthy biofilm. So the key is to take care of your oral health, to have a good biofilm in the mouth, which goes on down to have a good biofilm in your gut to keep the gut bugs happy.
Yes, many people can sort of understand that periodontal disease has something to do with bacteria. And when periodontal disease gets started, of course, the bad bacteria you call overgrow, and you have bad bacteria biofilms growing at the bottom of the pocket. That, of course, causes tissue damage and bone damage and loss of bone and movement of teeth and etc. But very few people are aware that dental decay is actually biofilm driven too. Bacteria cause dental decay, and it's the overgrowth of the bad bacteria that you're referring to that actually cause the breakdown of the tooth. So,
and actually the key to health is to feed the good bacteria so that they overpower the bad bacteria. Is that right?
Yes, I like to think of it as feeding the good ones and fighting the bad ones.
I love that, because I love the term microbiome is probably new to a lot of people, and basically I explain it to kids that you have good gut bugs that live inside, and in return for a warm place to live and free food, they do good things for you. They're like a internal medicine, your own living pharmacy inside your gut. I call it the gut pharmacy. But we've got to feed the pharmacy staff well and take care of them so they fight the bad bugs.